Hey, Billy Glisson with PowerCore 360 here with my fitness instructor, fitness trainer extraordinaire, Greta. Today we're talking about multifidus, right? And the multifidus, well, the first thing we're going to talk about, we've just done 2 videos on the transverse abdominis, and what we're going to tell you is and show you is those two need to work in harmony. And so last video we talked about how transverse abdominis gives you lumbopelvic stability or control, but it does that with multifidus, okay? First thing we're going to talk about is what the function of the multifidus is, all right? And we're going to actually give you just a little bit of anatomy. Hope you can struggle through this with us, but we're going to show you that real quickly. So you've got in your low back, this would be where your buttocks is. This is your lower back, the back of your spine. This would be the back of your head. And essentially what's happening here is you have an outer layer of muscles, right? And those outer layer of muscles, they look like this, and they attach to these bones here. And they're on the left side and the right side. And when they work and they shorten and they contract, they arch or extend your lower back, right? Well, those aren't the muscles we're concerned with. The multifidus is a deeper level of, or deeper layer of muscles underneath. So if we could take that outer layer off and we look inside, there's another inside layer called multifidus. And the way they attach is they attach out here to this bone, which is called the transverse process, and it goes up to this spinous process. And so the muscles don't sit up and down, they sit at these diagonal or oblique angles, and they attach from this bone to this vertebrae to that one. And this one might attach there, it might attach there, it might attach to 2 or 3 bones or vertebrae going up and down. Now here's what they do. When they shorten, when they contract, basically what happens is if it was going from there to there, it would actually start to rotate the spine. And so if this is connected to 2 or 3, it's actually going to create rotational movements or turning movements to the lower back, right? The thing you need to understand is it's designed for rotation. And even though in the fitness world and in the exercise world, we tend to be really stuck with movements that are kind of in sagittal plane, just moving forwards and backwards like a squat or an RDL. And we're not teaching even our planks, right? We're doing planks without any rotation. Well, a lot of people have needs, they have back pain, they have issues where their world and their job and their sport is rotational, but they can't control the rotation, right? Mm-hmm. So it's really important to work these because as one side is actually shortening, right? And I'm pulling and rotating that opposite direction, the muscles on the other side, the multifidus over here, are actually stretching. So it's really important, I guess, that you understand that basic anatomy. With that being said, we're going to move on and just kind of talk about what they do. So really briefly, if we talked about the multifidus on both sides of the lower back, when they both work together, they extend or arch the back backwards. If I'm laying on my side, right, and I'm doing or I'm standing here and I'm doing a side bend, so as I bend to my left, it's not just my abdominal muscles, my internal external oblique over here, or my hip muscles that are stretching. Actually, the multifidus on the inside of my spine, as I go to my left, on the right side, they're actually stretching. So side bending actually gets them engaged, right? And then we just showed rotation. That's very important. Let's get down into actually how do you turn them on, because it's extremely important for athletes, it's extremely important for the fitness world, and really for just everyday people. So we're going to start off with how do you turn them on, and we're going to go back into that on your back, if you would, Greta, with our knees bent, and it's going to be that same exercise. It's going to look like what we were working our transverse abs. So if you remember, we take our fingers inside the pelvis, we take the belly button down into the floor, that kicks on the transverse abs. That's wonderful. Now, how do you get multifidus on, right? So this is really difficult, and even when you work with a lot of therapists, they're going to tell you it's really difficult for them to try to teach their patients how to turn them on, but it's really critical. So as her belly button's being pushed down into the floor, we've instructed her to push her low back into the floor. By pushing her low back into the floor, she's actually starting to put a little stretch. She's stretching those multifidus and in a sense putting a load on them. And we said that the transverse abdominis and multifidus actually work in harmony. We want the front side, the transverse abs, which actually go 3/4 of the way around the back, and then the multifidus back there to all work and engage together. And a term I'm going to throw at you is called co-contraction. They're both contracting at the same time to give 360 degrees of control, stability around the pelvis and the lumbar spine, the lower back, if you would. Okay. So this first exercise is she's taking her belly button to the floor and pushing her back to the floor. We're actually now kicking on multifidus at a lower level in both the right and left sides. And so I'm asking her to feel and sense what that feels like. And for a second to get away from feeling what it feels like just to have the lower abs on, but what's it feel like to push both sides of those multifidus, those low back muscles, into the floor, right? Yeah. Once again, it's critical that she's breathing and she's doing that. We might do 5 reps, right? And hold them each for 5 seconds and start to develop the feel for this. And this is the lowest level basic beginning progression, right? Now we're going to add to this. We're going to take it up to the next progression. And what we're going to do is I'm going to ask Greta to basically turn those on, transverse abs on, multifidus on, lower back going into the floor. And I'm not looking for any movement of the hips and pelvis, but now I'm just going to actually tell her I want her to take her left foot and just pick up her left foot 1 inch off the ground and set it back down, right? And I'm going to ask her to keep those muscles on and keep breathing and control her lumbar spine, her lower back, and her pelvis as she just lifts the leg up and back. And we're going to do 5 reps of this. Okay, and now I'm going to ask her to do the same thing with the right leg. Now what I'm seeing and I'm watching over here, and I know this from doing this with her earlier, she has an imbalance. Her left side of her low back, her multifidus on the left side actually work pretty well. The ones on the right side, she has real difficulty holding everything in place and lifting her right foot just 1 inch off the ground and setting it down. This is a very appropriate beginning level for her to learn how to turn those on. Okay? Let's assume that she can't do that evenly. So she's got an imbalance, right, from right to left. I don't want her to just get up on her legs or knees and go to a higher level progression until we can actually have symmetry, balance, or evenness on the right and left sides. So I may tell her, you know what, I'm happy with your left leg being able to pick up and kicking on these muscles over here. What I want you to be able to do is maybe do 2 or 3 sets on the right side, right? So turn on the lower abs, push your right side of your low back into the ground, hold that, and pick up your right knee 1 inch, right foot 1 inch, and set it back down. So I might have her do 3 sets, 5 reps of this, right? And that way, before we move on to something else, we're working on that imbalance, okay? All right, let's assume that she's got that down. Let's go a little higher level. So the next progression is I'm going to have her go ahead and back to the left leg, turn everything on. I want her to lift up her left foot off the ground, and all I want her to do now is extend her left knee. But she can't lose any of this. She can't let the low back come off the ground. She can't let the transverse abs kick off. And once again, I'm looking to see that her pelvis and her ribs, and really nothing's moving. It's just all those muscles are kicking on to control her pelvis and her lower back. She's only going to extend her knee as far as she can and still maintain a good quality kind of contraction or stability control there. I do 5 reps with the left, and then let's go to the right. Turn everything on. Right foot comes off the ground 1 inch. And we start to straighten and extend that right knee a little bit. And you can see she's not going out as far, but she's being really good about sensing and feeling with her body where she has the control. I don't want her to take this quick movement out with her foot and let everything go, which is what everybody kind of normally does. Once again, I want to see evenness. And ultimately, I'd like to be able to see her be able to go back to your left leg for a second, turn everything on, and she extends her knee. And if we wanted to, she can get her leg all the way out straight. I'm going to support her for a second here. What would be really awesome is if she had the ability to go ahead and let this hip drop down and maintain that and not lose that, right? And to be able to do that, that would be the next progression with the left and right leg. All right, that's cool. That's a really low-level progression and actually very appropriate for her, right? And very appropriate for most people who are a lot of us walking around that can't turn those muscles on, right? Let's talk about the next one. And so we talked about side bending or lateral flexion. So let's have you roll over on your left side, and you're going to be up on your elbows and your knees. So we're going to do a side plank, okay? And I'm going to ask her just to go up into a plank position on her elbow and her knee. So go ahead and raise up. And she's going to hold that. So we're actually working on the multifidus muscles on the left side of her low back, right? And they're actually contracting to lift everything up and stabilize it there. I'm going to have her set back down, and before she goes up, I'm going to keep cueing her, and you're going to have to do the same thing with yourself or your people. Lower abs going first. Kick on your transverse abs, hold them on. Now take yourself up into that position. And those deep muscles, the multifidus, the transverse abs, they're working. Certainly there's other muscles working as well. But this is really good for her, and I can even watch her here. You know, this is a low-level plank, but the way I'm having her do it, there's shaking going on. She's trying to kick a lot of muscles on and hold them on, okay? And relax, okay? I'm going to have you roll over and face the other way and go on your right side. Bent knees and hips, abs go on. Go ahead and take it up, and now the multifidus muscles on the right side of her low back are contracting to lift everything up and stabilize. Really good higher level progression, but certainly needs to be added to your routine. Okay, and relax. Roll it back over. And I'm going to have you, I'll bring the ball to you. And I'm going to have Greta sit on the ball and face the camera. And one of the things we do with a foam roller, oftentimes we're working with athletes, we have them sit tall, okay? We ask them to take their knees and squeeze on a foam roller. That helps turn on some of the adductors, the groin muscles, and may help turn on transverse abs, lower abs. But I'm going to cue her right now to say, turn on your lower abs, right? Transverse abs. And now I'm going to actually ask her to rotate to the right. So she's rotating to me, even though her transverse abs are on, she's actually getting rotation that's going on in those multifidus in the lower back, right? So she's turning one way, the muscles on one side of her spine are shortening while the other ones are stretching, okay? Let's go the other way. And back to the camera. Any type of rotational movement will start to work on your low back and the multifidus movements. There's certain exercises or postures or positions you can get into which are going to be much more focused on them, right? As you do this, once again, if you're seated, you can go to the gym, you can sit on a football, put a foam roller between your legs, turn on your transverse abs, keep them on, and just rotate right and rotate left. Wonderful, okay? Mm-hmm. I'm going to put a shameless plug in because one of the things we do with athletes, and we have a free app. If you go to our PowerCore 360, if you go either for an Android or for an iPhone, you can go to the PowerCore 360. You can download the free app. And when you download the app, there's going to be a section in there for Core 4. And in the Core 4 section, it's going to actually show you how we use our products and how with athletes, how we use a torso harness to actually build strength and resistance and flexibility in those multifidus muscles. Because for us, with athletes, when I'm teaching an athlete to run, jump, throw, hit, kick, something with rotation where they need more power, I need more strength and flexibility, more control at a much higher level. So instead of just doing something on the ground with body weight or just sitting there doing this with just body weight, we use resistance bands hooked to a harness, right? Makes sense? Greta, to try to close up a little bit, multifidus is important, transverse abs are important. Who needs to turn on their multifidus? What are your thoughts?
Yeah, so athletes who rotate. So people that do golf, baseball, MMA, all sorts of different sports, you name it, that do a rotation of hitting a ball or throwing a ball, different things like that.
Gotcha. One quick thing. Athletes, we talk about all times rotating like this and creating power, but it's also not just about creating it, it's about tolerating it.
Yeah.
I love to play golf. I love to go out and see if I can hit the ball 300 yards still. I work with all kinds of rotational athletes, and they're swinging clubs, they're swinging bats, they're swinging their fists, they're swinging their foot. They're rotating, and it's not just a matter of them creating more power or speed with the rotation of the body that creates torque, but it's also tolerating it. So with athletes, it's not just how hard can you hit the ball, right? How fast can you rotate, arm speed, foot speed? It's about maintaining that, being able to tolerate that torque. So injury prevention is key. Who else needs this?
People who move and rotate, so pretty much every single person. To go grab a bag of groceries off the ground, to do different things, pick up random things on the ground, or go grab something out of a cupboard, different things like that.
And you know, as you're doing that, I'm watching you because you're kind of using your right hand.
Yeah.
You know, so you're telling me people don't go and pick up things like this?
No.
Because in the fitness world and even in the strength conditioning world at the collegiate and pro level, we still train a lot of people to do this, right?
Yeah, exactly.
So it's what? Multifidus are working, but they're working both sides at the same time. There may be resisting rotation when in fact we may want to have rotation occur and control that rotation, stabilize it, right? So anyway, your point was as you're reaching, a lot of everyday activities that people get into, right, are one-armed activities.
Right. Yeah.
So I guess one point is, if you were bending over to pick up a sack of groceries out of your car, something off the ground with one hand, that's the way most of us do it, right?
Yeah.
Can you develop an imbalance in the multifidus on one side of your back versus the other?
Definitely, yeah.
So what would you need to do?
Doubling the exercise on your weaker side to create that balance, to become more stable and be able to rotate and grab a bag with either side.
Yeah, cool. I know in the golf world, I worked with a pro golfer on the PGA Tour a few years back, and one of the things he said to me was, Billy, every day when I go out and I swing, if I've swung 50 times from right to left, my normal swing, I spend a fair amount of time at the end of the practice round turning back to the left, right? So that in essence for him is an easy way of creating symmetry and balance.
Cool.
For the multifidus, it's really important. Yeah. What else?
And then just people with back pain, kind of realigning those muscles and reteaching those muscles how to rotate and work in different planes rather than what you were talking about, sagittal plane of up and down, and not letting those multifidus muscles turn on.
Cool. One of the things we'll talk about in one of the next issues in the next videos is we're going to talk about when a person does have a back injury, what happens to the multifidus, because some really important things happen to that. And we'll talk about that in a later issue, but really important. Glad you're here with us today. If you have any questions, if you like this video, please subscribe. Please like us down below. If you have any questions about our product, go to powercore360.com, and we'll see you next time.